Anatomical terms of ball medicine. Before we get on the ball, let's cover some anatomical terms that will be used during your workout's medicine ball. No one's going to test you on the correct use of any of the terms, but it's really helpful to have a general idea. Anatomical position. This is essentially the default position for your body, as nearly all joints are in neutral position with the exception of your elbows, which are rotated forward to bring your palms onto the frontal plane, feet face forward and are about shoulder width apart, spine is erect, arms are extended at the sides of your trunk with palms facing forward. The three different anatomical planes of movement are median, frontal, and horizontal. The median plane splits your body laterally into right and left halves with a line vertical to your belly button, the medial line. The frontal plane splits your body into a front, anterior, and back, posterior, from the side, bisecting your torso vertically in a line that runs through your ears, shoulders, hips, and ankles. The horizontal plane splits your body into upper, superior, and lower, inferior, halves at your belly button. Athletic position. Similar to anatomical position, this is often described as a ready position for many sports or training. In a standing position, your feet face forward and are approximately shoulder width apart and slightly rotated outward, laterally, about 10 to 15 degrees for greater balance. Knees, hips, and elbows are slightly bent, and arms are rotated slightly forward at the shoulders. This position should have you ready for quick action or reaction in any direction, primarily a median or horizontal plane. Rotation. You will be using this one quite a bit, primarily when twisting the trunk. Simply put, this rotation is bringing the side of the body bisected by the frontal plane toward the medial plane while traveling along the transverse plane. Range of motion, ROM. This is the entire spectrum of movement allowed by one's anatomy and physiology. Limits are based on joint, muscle, ligament, and cartilage positioning, size, shape, and condition, essentially the mechanical limit you could possibly move if you were in top condition. Training to strengthen your musculature and develop more flexibility will allow your joints to function with as wide a ROM as possible. Flexion and extension. Often confused, these are relatively easy to remember once you get the general mental picture. Flexion is accomplished by bending a hinge, elbow, knee, joint, while straightening is an extension. Forcing one of these joints past straight is considered hyperextension, and commonly responsible for serious injuries. Abduction and adduction. Abduction of the hip or shoulder joint occurs when the leg or arm is lifted outward, laterally, from an anatomical position. Your shoulder has a much wider range of motion, ROM, and adduction encompasses the entire lateral movement upward of your arm from your side to directly over your head. Adduction is the motion of bringing the arm or leg back to anatomical position. Thank you for watching, and if you have any comments or questions, don't hesitate to share with us to spread the benefit, and don't forget to subscribe and activate the bell to receive our new contents.